Alright, today we're going to be hanging a secondary bag to infuse alongside our primary. Generally, your secondary bag is an intermittent infusion, usually dosed maybe every 8 hours, 6 hours, anyway, usually intermittently. My pump is generally running when I walk in the room. I'm going to Here, I don't have it on. I'll just show you how to turn it on with the orange button. I can program my primary rate by hitting primary rate and say the ordered amount was 100 an hour. Primary volume to be infused, VTBI, and that would be however much is in your bag. And say if I had a brand new 500 milliliter bag, I would program 500. This looks like I've infused already 100, so I'm going to program 400. Many people will tell you to program it with 50 milliliters less than what you think you have. That way when the pump will beep, and it'll give you some time to get a new bag back to the room. I'm going to hit primary start, which will begin my infusion. So we're saying that I have walked into the room and I have a primary line that's running. I have an order, let's say this is for ANSEF. I've verified this against my MAR, done my 6 rights, right drug, right dose, right route, right time, actually 5 right now. I won't document until I've done it. I verify this drug with the patient's armband as per your usual orders for giving meds. And I have also made sure that I've verified allergies, that the patient is not allergic to this drug. I obtain a secondary medication set. Again, it's perforated along the side. Pull out my tubing. The first thing I want to do, as always, make sure that I close my roller clamp as soon as I pull it out of the bag. You need to get that into your mind so that you don't have an accident, make an error. Okay. Again, I have the injection port on this bag, and then I have the port where I'm going to spike my bag. I open it up, I maintain sterility of that tip, maintain sterility of my spike, insert. Again, this will not leak until it has been spiked. Alright, so I've spiked my bag. I have 2 methods available to me for priming my line. The first one is the same method you use to prime your primary line, which was squeeze your drip chamber until it's 1/3 of the way full. Open this up and let it run slowly till it gets to the tip. Now, with an antibiotic, I've only got 50, in this bag, I've only got 50 milliliters to begin with. I can verify that by looking on the bag. It tells me what this is mixed in. So I've got 0.9% sodium chloride mixed for my ANSEF, and then I have 50 milliliter bag. But since it is such a small amount, it's very important that I don't be dripping this out when I prime my line. So rather than just opening this up and trying to catch as it gets down to the end, what I'm going to do is do what's called a back prime. And again, anytime that you're going to access a port, you want to make sure that you do a good vigorous scrub before you access your port. Okay, and notice that I don't have to turn off the pump in this case. I'm going to open this up, and again, I'm going to maintain sterility of this tip now along with this port that I've cleansed. All I need to do is screw that on, push and screw. Okay, I have my roller clamp closed. I'm going to lower my secondary bag lower than the primary and open it up and do a safe back prime. The air will go up into the bag and then once I start getting some fluid in the drip chamber, I stop. And it is as simple as that. It's a less risky way because certainly you don't want to waste any of your medication. So once I've done the priming, I then need to lower my primary bag, okay, so that my primary bag is always lower than the secondary, because there's a certain amount, even though you've got this pump going on, gravity is what takes over anything above the pump. So if I don't lower my primary bag, it may continue to pull from my primary, even though I've told the pump I want to pull from the secondary bag. It will pull from whichever one's higher, and again, whichever one has an open pathway. So before I open my roller clamp, I want to program in my desired rate, and that's, so I'm going to secondary rate, and it tells me 100 milliliters an hour. And I looked on the bag, I saw my secondary volume to be infused is 50 milliliters, so I program 50. I go ahead and hit start and immediately open my roller clamp, and I'm going to stand here until I verify that this is dripping. I certainly would never want to walk away until I verified the fact that my drug is infusing. If you know, this happens at times in hospitals where someone failed to open the roller clamp, even though they did program the pump exactly. They come back and it's been 8 hours, the drug has not infused, and then you have a med error. Certainly we don't want to be making any mistakes. Sometimes there's a little delay from the time that I opened my roller clamp till it actually started dripping, and if you could see there was a delay, but usually it's because there's an air bubble right here in this little port, and so you'll see it actually pulling down the level of fluid in your drip chamber. Okay, so once this entire 50 milliliters has infused, the pump will automatically kick back on and start drawing from the primary. Obviously this one will be empty. Okay. Anything else I want to tell you?